All right, welcome back, everybody. Do any of you have, can all of you hear me and see me? All right, so let's go to the next chapter. Any questions from this chapter? If I could get the next chapter put on the board, please. There we go. Okay, let's get some color here. Excuse me. This chapter, I'm going to call it a medium yield with defense mechanisms as you were in step 1. And I wouldn't imagine any defense mechanisms in step 3, but step 2 you could still have a few, but they'll probably be linked to certain disorders. So I always think I prefer to be safe than sorry. So let's go over all of them, and then I'll review certain disorders with certain of these structures, okay? So before we begin, we need to understand that these psychic structures are nothing more than things that Freud thought of. So there's 3 main ones. There's the id, there's the ego, and the superego. So the id is nothing more than an instinct or a drive. So this is something that we are born with, right? We're born with instincts. And there are 2 basic instincts. How many of you out there saw the movie Basic Instinct? And if you didn't see it, you know what it's about. Well, Basic Instinct, the movie with Sharon Stone, was about sex and aggression. And those are the things that we're born with. As we grow up, we learn from our parents. We get values, we get ethics, we get a sense of, excuse me, morality. We know the difference between right and wrong. And that's what the superego is. So the superego we get from our parents. And that is the conscience, values, ethics. So I'm sure that you've all seen movies, right, where someone has a dilemma, and on one shoulder, right, you've got the little angel, there's the halo, and on the other shoulder, you've got the devil, there's his tail, this is his pitchfork, right, and here are his horns. How many of you have seen cartoons or movies or anything like that, right? We all have. Oh my God, one of you was born in 1988. I just feel so old. So the id, the id would be the devil, right? What's the id telling you to do? Do it. So the id is saying, go ahead and do it. Well, here we have a cartoon character. The angel, there you go. The angel. Wow, these class texts today are awesome. I don't know if they know what I'm about to say, if they're reading my mind. So the angel is, of course, the superego. So the id is what we want to do. Right? Superego is what we should do. That's the difference. Most of us, the id and the ego, the id and the superego are equal. Some of us have problems, especially with the superego. Some people, their superego is not intact. It's like their superego has holes, kind of like Swiss cheese. So they can, this is a type of person that can lie, steal, has no remorse, has no empathy. Who am I describing? The antisocial and politicians, exactly. I don't know if any of you have seen the show House of Cards. OMG, let me tell you, you need to watch it. Get Netflix just to see that show, House of Cards. You cannot imagine that politicians could be so ruthless, but you know what? I think they are. So the individual who does that is able to do that because their superego is not intact. All of us, which I hope have intact superegos, it would bother us to steal from a child. It would bother us to do something and hurt other people. Yet these individuals do not, because their superego is all messed up. Okay, now, does this have to, is this going to appear on the exam? Probably not. Why did I put this here? Because I think you should have seen it once in your life. So the point of this, that the ego is really the one that's the most important one. The ego is the mediator between the id and the superego. The ego is the one that's responsible for defense mechanisms. So what is a defense mechanism? It's the ego's way of warding off anxiety. So imagine that we were to live in a bubble, right? We have a shield protecting us. So anger, upset, being abused, all of these things are attacking us, but we're not aware of it. So what does that mean? That defense mechanisms are unconscious. And they're all unconscious except one. And this was a step one question. Which of the following defense mechanisms was conscious? And that, of course, everybody knew: suppression. They're discrete, they're dynamic, they're irreversible. They're supposed to help you, but they can hurt you. That's what you got to understand. So here's the rule that I want you to follow. They will give you a question related to a defense mechanism. Then they want to know what to do with it. If it's hurting the patient or not hurting the patient. So if the defense is hurting the patient, what do you think we should do with it? We need to change it, right? We need to fix it. We need to confront them. If it's not hurting him, then we want to just leave it alone. And I'm going to go over a question with you later that deals with this, okay? I'm definitely having mouse problems here. I'm going to use something else. So we leave it alone, and that should be okay. Let's move on. Okay. Now, let's review the first of the defenses, which is projection. And in projection, you are transferring your feelings or wishes onto someone else. So what does that mean? Whatever it is that I'm thinking, I'm going to say you're thinking it. Whatever it is that I want, I'm going to say you want it. So if I don't like you, what I will probably say is you don't like me. Okay? If I'm in a relationship with you and I'm cheating on you, then I'll probably say you are cheating on me. And that's what projection is all about. The question will be, where do we typically see projection? What personality disorder uses projection the most? I'll give you the clue. It's the personality disorder that starts with the letter P, and some of you have it, the paranoid, exactly. The paranoid personality, what's unique about them? They're suspicious, they're mistrustful, they always question the loyalty of family and friends, they think people are talking about them, etc. Why do they do those things? Because they're the ones talking about people and doing things to people. Make sense? So the paranoid personality, link it to projection. That's one. Then we have another personality, another defense mechanism, which is denial. Now, what do we need to know about denial? In denial, it's used to avoid becoming aware of some painful aspect of reality, okay? So someone has died, your husband died, your wife died, you still cook for two and set the table for two. That's denial. Where do we tend to see a lot of denial? We tend to see a lot of denial in patients who are substance abusers, right? The substance abusers, there's nothing wrong with me, I'm not drinking, I'm not using drugs, you're the one that thinks that there's a problem when actually it's the other way around, okay? So you'll see, whoa, my mouse has gone crazy now. So you'll see a lot of that in substance abuse. Where else do we see a lot of denial? In the hospital setting. When patients are sick, you just diagnose someone with cancer. No, there's nothing wrong with me. That's what you typically find. Let's go over a question. Let me get the whiteboard. Hold on. So you've got, give me a second here. You got a patient who comes into the hospital with chest pain, right? He gets admitted. He's on IV meds. He's in telemetry. And he's taking his meds as well. Not only IV, let me remove the meds. So he's got IVs in line. He's in telemetry. He's taking meds. And he says, there's nothing wrong with me. Now, what defense is that? Everyone agrees that that's denial, right? But the question is not going to be, what is it? The question is going to be, what is the next step? Do you, A, confront? Do you, B, refer to psychiatry? Do you, C, do nothing? I'm not going to write anymore. What do you think? You do nothing. Why do you do nothing? Because even though he's in denial, is it interfering with treatment? No, exactly. What if the next day, right, he pulls out the IV, he spits out the meds, and he wants to leave the hospital? And we're going to have the same choices. What do? Now you confront. And by confront, what I'm implying is basically you have to have a conversation with him. Do you understand risk and benefits? Do you understand that if you walk out that door, you can die? If the patient says, yep, I got it, you say, later, Gator, and out you go. This, of course, is not a right to refuse question because you know the choices would be different. Have you done Epi Public Health already? Okay. Are you doing it after me, or I know that I moved my schedule around? Okay. Of course you're doing it after me. That was a silly question of me. If you haven't done it before, where else are you going to do it? You see what happens the older you get? Things come out of your mouth that you just can't control. Okay. Let's talk about more defenses. We've got the defense of splitting. And splitting is when external objects are either all good or all bad. Now, what they'll probably do on the exam is that they're not going to use the words good or bad. What they will use is the word devaluation and idealization. I'm going to write it for you. Just give me a second for it to appear. Now, idealization, of course, equals good. Oops. And devaluation, of course, equals bad. So what you might see is that they'll talk about the patient being idealized or devalued. So what's unique about splitting is that you compare good versus bad, right? So Dr. A, oh my goodness, doctor, you are the best doctor in the world. I wish everyone was like you. Yesterday I came to your office and I saw your associate. He was just horrible. That is what splitting is all about. The good doctor is idealized, the bad doctor is devalued. Tylenol is a miracle drug. Aspirin is totally useless. So again, I'm comparing pain meds. Tylenol is wonderful, aspirin is terrible. What they could do on the exam is they could only give you half of the split. For example, my boyfriend is the best in the world. Is that splitting? Is that idealization? Let me get a text box in here. Give me 1 second. So what I'm saying is my boyfriend is the best in the world. Is that A, splitting, B, devaluation, or C, idealization? And I'm going to make you pick one. My boyfriend is the best in the world, because all that I'm saying is good. Then you would pick idealization. Everyone agree? Okay. Now what if idealization is not there? My boyfriend is the best in the world. Do you put splitting or do you put devaluation? Then you put splitting. Exactly, because splitting has good and bad. And the good is part of it. And if they want to be tricky, they might use the word primitive idealization or primitive devaluation. It's the same thing, okay? Don't be taken back by that. Who uses splitting a lot? The borderline personality disorders. Now, blocking is just a temporary block in thinking. What's unique about blocking is that you are aware of the memory loss. Wow, I can't remember his name. It's right on the tip of my tongue. That's the blocking. You know that you're forgetting something. Can histrionics do it? Yes, but the big one, the bang for the buck, is the borderline. Regression is where we are returning to an earlier stage of development, meaning a stage we had already completed. For example, let me go to the whiteboard. If we're thinking of children, let me get some color in here. Give me 1 second. And we're thinking of Freud stages, right? We've got oral, we've got anal, we got phallic. And no, these things do not appear on your exam. So oral is from birth to 2. Anal is like from 2 to 4. Phallic is like from 4 to 6. So here we have a 7-year-old who is already toilet trained, who does not suck his thumb. So what on earth could make children regress? Well, having a sibling could make them regress. Why? Because now they're not the only one in the house. Maybe the parents moving away can make them regress. So any stressor could make them regress. And by regression, what we're talking about is that we're going backwards, back to a stage that you had already completed. And toilet training occurs in the anal stage. So now the child wets the bed, now the child sucks his thumb. That example, and they're going to ask you what defense mechanism is that, and that's regression. What do we need to know about regression? It's the least mature or the most immature. Either one, we're talking about the same thing. So either the most immature or the least mature. Now let's talk about adults. Adults can regress as well, right? How do we regress? We regress when we're sick, right? We regress when we're in the hospital. And those are just some examples. When we get sick, tell me how we regress. How do we act? We act like kids. We act like babies, right? We want to be pampered. We want to be taken care of. We talk in our baby voice. So that's a type of regression. So when you act like a child, that is regression for an adult. When you have a temper tantrum, and you know an adult should not have temper tantrums, right? So if you have a temper tantrum, then you know that that is also regression. So if I get angry with one of you now, and I do, and I stomp out of the room, and then they ask you, what defense is she using? You would have to say regression, because I'm acting like a child. Does this make sense for everybody? All right, let's move on. Then we have somatization. And somatization is when psychic derivatives are converted into bodily symptoms. And these are the main defenses of the disorders that were basically the somatoform disorders. These are the disorders where your brain convinces you that there's something wrong with you. Your brain convinces you that you have cancer, that you're blind, that you're paralyzed, that you can't move, that you can't speak, that you're deaf, that you're going to die, that your nose is too big. Those are the types of disorders. But what's unique about these disorders is that when you do the physical exam, it's typically normal. When you do the workup, any blood work, any CAT scans, anything, it's always going to come back negative as well. So these are disorders that are purely psychological in nature. It's your brain convincing you that there's something wrong. And that's why the treatment of these disorders is usually individual psychotherapy. So are we okay so far? Is this a good speed for everybody, or do you want me to slow down? Do you want me to go faster? Okay, let's move on. Then we have introjection. And introjection is nothing more than the opposite of a projection. What was projection? Transferring your own thoughts, feelings, wishes onto someone else. So introjection is the opposite. In projection, what I'm thinking, I'm going to say you think. In introjection, what you think, I'm going to say I think. Okay? So it's the unconscious form of imitation, if you will. So when the resident acts and dresses like the attending physician, and he doesn't know that he's doing it, that's called introjection. If you know that you're doing it, then that's called imitation. Displacement is when an emotion or drive is shifted to another that resembles the original in some aspect or quality. So let's say I'm at work and I'm angry at my boss. I don't yell at my boss because you know that's not a good thing to do, right? So I go home and I yell at my family. I throw something across the room. I kick my poor dog across the room. So instead of taking my anger out on my boss, who is the original person, I take it out on someone else. So the emotion is shifted. That's what a displacement is all about. And by the way, I would never kick my dog. So that's what this is, okay? And as I said that, he ran out of the room. He's been here watching me all night long. So are we okay so far? Every once in a while when I teach, he jumps on me. Then we have repression. Is he a string too? Oh, good God, I hope not. But a lot of psychiatrists have those types of dogs. I don't know why, at least where I live. Okay. Then let's talk about repression. And what I want to do, let's go to the whiteboard, is I want to make sure that you understand the difference between, let me get some color here, between repression and suppression, because they're very, very different, okay? Repression versus suppression. So in repression, and it's probably 1Ps, in repression, you are unaware of the memory loss, okay? So these are memories that you have that you don't know that you have. So remember, what do you think a defense mechanism's role is? To protect us or to hurt us? To protect us, right? So imagine that we've got this big file cabinet inside our brain, and in this file cabinet are all of our bad memories. So things have happened to us, and we don't know what's in there. The fact that they're in there, and we don't even know this exists, is a repression. But let's say now we're watching TV, we're reading a book, we're talking to someone, or whatever, something triggers a memory. This file cabinet opens up and the memory comes out. Are you aware now of the memory? Yes or no? Yes. The fact that it's probably painful and you'd want to forget it is what a suppression is all about. So a repression, we don't know that we have it. Suppression, we do. So that's the difference between one and the other. So these are memories that we either don't know we have or we know that we have. They're painful, we'd rather forget them. Let me give you an example. Let's get, oh, this is the whiteboard, and here I'm waiting for it to appear. You are 18 years old. You go to the doctor's office. The doctor asks you, have you ever been abused? And you say, nope. In your records, between the ages of 4 and 8, you were treated for sexually transmitted diseases. Now, anybody who is young and is treated for STDs, what is typically the reason? Abuse, right? Something happened. Some adult was having sex with you, and that's what caused the transmission of these diseases. But yet, you say, So the question would be, is this denial? Is this repression? Or is this suppression? What do you think? Wow, no one's picked the right answer. Now that you know what I just said, denial is probably the correct answer. Because denial, you're just saying something didn't happen. Nowhere in that question does it mention the word memory. Remember, these two deal specifically specifically with memory. So this question, so if you say nope, the answer is probably denial. Let's make it a different question. What if the question say, what would help explain her memory loss? So same question, 18-year-old, you go to the doctor says, have you ever been abused? You say, nope. We look in your records, you were treated for STDs. Which of the following would help explain her memory loss? The answer would then be B. Everyone agree? Because now we know that it's about memory. Let's make it a third question. Instead of her saying nope, she says yes, but I don't want to talk about it. Then what's the answer? Then the answer is C. Okay? So technically, they could break down this question into various questions. If repression, now, what if denial were not there? So does everyone understand these three in their simplest forms? Okay, now what if we go back to the original question and denial, it wasn't a choice? So we have the 18-year-old who you ask her if she's been abused, she says no. Then what do you think the best answer is between repression and suppression? Then you know that repression is the better answer. But if denial and repression are both choices, something in the question must indicate whether it's a memory or not. If it is a memory, it's got to be repression. If it doesn't mention it, then it's probably going to be denial. Does that make sense to everybody? All right. Let's move on. Let's go back to the slides. Okay. Then intellectualization is the excessive use of intellectual processes to avoid effective expression or experience. So when we learn about something, remember in step 1 that curve between anxiety and learning? Do you remember that? So when we learn about something, what happens to anxiety? It tends to decrease, right? So here, when we learn about something, anxiety decreases. Why are we afraid of space? Because we don't know enough about it. Why are we afraid of the ocean? Because we don't know enough about it. Why are you here on a Friday night listening to me babble? Because you're afraid of the test. You want to learn about it so that you tend to do better. So therefore, intellectualization is going to use that very same concept. You've just been told you have cancer. What do? Well, I learn about it. And the more I learn about it, what happens to my anxiety? Anxiety goes down. So what do? I read up on it. I get self-help books on it. I go to seminars on it. And when I talk about it in a very intellectual way. So imagine you've got HIV and now you've got Kaposi's. It is interesting to note the specific skin lesions which seem to arise as a consequence of my end-stage disease. Come on, if that were you, you'd be freaking out. But yet this person talks about it in a very intellectual and unemotional way. So what happens to anxiety? This is his way of coping. That's what intellectualization is all about. Does that make sense to everybody? Okay, let's move on. Then we have isolation, which is just separation of an idea from the affect that accompanies it. So what happens here is, remember what affect was? Affect was expressing emotions on your face, right? So in isolation of affect, something happened to you, but guess what? You show no emotion on your face. So typically these isolation of affect questions, it will be a question where something has happened. So they give you a story, a bad story, and you show no emotion. So you're outside planting petunias with your daughter. She runs out into the street. She gets killed. You don't cry. What defense mechanism is that? Isolation of affect. You're telling the doctor about your parents' recent death 2 days ago, very matter-of-factly. What defense mechanism? That's isolation. So when you don't show emotion on your face, isolation of affect is the answer. Rationalization is when we make an excuse for ourselves. Ourselves. Did you ever get bad grades in school? You know those teachers who tell you, this is what's going to come out on the test. How many of you have had teachers like that? Right? And then nothing is on the test from what they tell you. And everything is from the book. And you get a terrible score. How many of you have had teachers that have done that? Isn't that frustrating? Who have you always blamed? I know who I have blamed. Do you think I blame myself? It's the teacher's fault. Even though we knew that the book was going to come out, we still blame the teacher. That's rationalization. Who uses this a lot? Well, I'm going to go back to the one thing that maybe I can drop. Okay. Drinkers, substance abusers. I'm not an alcoholic. I have a lot of stress. I need to unwind. Or when I go out and take my clients, I need to drink with them. That's a rationalization. That's you making an excuse for your own behavior. So does this make sense to everybody? Okay. I would always get bad grades in conduct, and I would always blame it on the teachers. The teachers pick on me, is what I would tell my parents. They never believed me, of course. Reaction formation. Reaction formation is seen in obsessive compulsive disorder. So here we have, let me go to the whiteboard. We have your brain, or you, the you part of your brain, right? You want to do something, but what you want to do, right? You find it unacceptable. So how do you think the brain fixes it? Well, the brain fixes it by turning you into the opposite of what you want. Because if you turn into the opposite, are you more likely to do it or not do it? What do you think? Right? So what it does here, it stops you from doing it. So if I like to start fires, then what could I become? Then you become a fireman, right? What does the fireman do? Put out a fire or start a fire? Put out a fire, right? If I love porn, I'm one of these porn freaks, right? What do I become? I could become a preacher. I could become anything. Now, please don't think that, or an anti-porn advocate, exactly. Don't think that everybody who's a nun or a preacher really is a freak, because that's not the case. But if you are, this would be a great situation, okay? So that's what reaction formation is all about. And when we're looking at obsessive compulsive disorder, reaction formation is the obsession. And that's a common question that they'll ask. For example, you've got a patient who's got OCD and he washes his hands 1,000 times. Or he believes he has a fear of contamination. Is that the reaction formation or is that the undoing? What do you think? That's the reaction formation. The people who have OCD, maybe unconsciously, they want to get dirty. Maybe they want to get down and dirty and filthy. And that for them is unacceptable. So what does their brain turn them into? Germ freaks. So instead of touching things, what do? I stay away from things. Why? Because my brain has convinced me that everything is dirty. That's the obsession. Now, the next defense mechanism is undoing. And undoing is acting out the reverse of an unacceptable behavior. So if you're a germ freak, what would be unacceptable to you? Getting dirty. How do I undo getting dirty? I wash my hands. Right? Make sense? If I'm a fire setter, what would be unacceptable to me? Setting a fire. How do I undo it? By putting it out. So the compulsion is the undoing, which is typically an act. When the preacher is preaching, he's undoing. When the firefighter is putting out the fire, he is undoing. So remember, the obsession is the development of a character trait, and the compulsion is the undoing or the act itself. Do you see how these two play hand in hand? Yes or no? All right, now let's review one more thing that a lot of you confuse. So we've got here what you want. Here you stop it, which is the reaction formation. And here you do it, which is sublimation. In sublimation, you have turned something unacceptable. I'm getting a little hit ahead of myself so that you can understand what this is all about. So in sublimation, you are turning something unacceptable into something acceptable. So let's review it. If what I want is to start fires, how do I stop myself from starting a fire? I become a fireman. Everyone agree? Well, how do I start fires and it's okay? Well, I go to work in Hollywood in special effects. So you know in the movies when they blow buildings up and have fires, I do it. But yet I'm doing it in a controlled way. I'm not going to get arrested. I'm not hurting anybody, but am I still doing it? Yes or no? Yes, that's sublimation. That is why sublimation has been called the most mature of all the defenses. You turn something bad into something good. So if you're one of these porn freaks, right? Here, well, let's make you a nun. Here, let's make you a censor. What's a censor? The one that rates the movies, right? Now, for me to rate a movie, what do I have to do? I gotta watch it. So I'm getting to see the porn, but you know what? I'm doing it for the good of humanity. I'm just giving it a label. Does this make sense to everybody? Okay. All right, perfect. So let's go back to the slides. So undoing was acting out the reverse of an unacceptable behavior. And remember, undoing is an act. So it's something that you are physically doing. You are preaching, you are putting out the fire, you are washing your hands, you're checking the stove. It's something physically that you're doing. Acting out is just an outburst, that's all it is, whether it's emotional or behavioral. It's usually age appropriate. So if an adult acts like a child, it's regression. But if a child acts like a child and has a temper tantrum, then that would be acting out for them. Humor is just letting you, humor would just be letting you, what am I trying to say? You know, you turn something into something funny. If you watch comedians or comics, they always tell you about their lives, the horrible things that they do. That would be humor. Am I freezing? Yes or no? Okay. Okay, someone talked about Dexter. Do all of you know who Dexter is? Dexter, of course, is an antisocial personality disorder. So he likes to kill, right? That's a bad thing. Do we all agree that killing is bad at least? Yes, but he decided to kill bad people. So he knows what he's doing. So typically defense mechanisms, remember, are unconscious. But let's pretend, not that Dexter. We're talking about Dexter the serial killer, not Dexter the cartoon Dexter. So, no, not that Dexter. That Dexter didn't kill people. We're talking about the Dexter that would cut you up into pieces and throw you in the ocean. So that Dexter, exactly. So that Dexter knew what he was doing. So typically it's not a defense, but it's sort of defense-like. So in sublimation, he turns something unacceptable into something acceptable. He's ridding humanity of all these bad people. So yeah. Okay, let's move on. That was a good show, right? How many of you saw it? Okay. How did you like the ending? I wasn't too happy with the ending, right? Okay. I wanted him to go off with her and they went around killing everybody. Okay, so sublimation we talked about, suppression we talked about, dissociation is splitting off of the brain from conscious awareness. This is, of course, the main defense of guess what disorders? The dissociative disorders. So what this means, of course, is that the you part of the brain is unaware. Your brain is still moving on, but you don't know what's happening. You meaning the conscious you. So everybody here dissociates. How many of you have gotten in your car and driven and you get to your destination and you don't remember getting in the highway or driving or whatever? How many of you have done that? All of you have done that, right? That's dissociation. So your brain is active, but you are kind of like in limbo. That's what this is all about. All right, so we're done with the defense mechanism. So remember, those are going to be high yield as far as what do they probably ask you. Paranoid personality, know that it's projection. Borderline personality, know that it's splitting. Obsessive compulsive disorder, know that it is reaction formation and undoing, and be very aware of what the two differences are. Know the difference between repression, suppression. Denial is popular on the exam. And I think those are the ones that are the most popular ones. Isolation and flat affect. Isolation of affect. Someone's asking me, Jose is asking me, what's the difference between isolation and flat affect? Is just no emotion. Isolation is a defense mechanism that stops the emotion. If that makes sense. Make sense? Okay. Could Dexter be sublimation in a way? It can be. Because he turns something unacceptable into something acceptable. Okay. Paranoid, anything with the word paranoid, I want you to think projection. So if it's, and remember, the paranoid schizophrenic doesn't exist anymore. So if it's the patient who believes that people are doing things to him, then that's paranoia. That's projection as well. We're going to go, all the personality disorders are in a chapter. So we'll probably go over them not this weekend, but when we meet again. An example of undoing, okay. Examples of undoing could be washing your hands if you think you've gotten contaminated. For those of you that are superstitious and you spill salt on the table, what do? You throw it over your shoulder. That's undoing. Okay, makes sense? All right. This section here, whenever you do the EpiPublic Health, you're going to go over this section in detail. So let's review some of it. What do we need to know about IQ? That all IQ measures is academic performance. And what that means is what's expected of you. Not what will you become, but what's expected. You could have a very super duper high IQ and live under a bridge and eat cat food. So it's what you could become, not what you will become. There are two ways of measuring IQ, right? One is the mental age method, and the other one is the deviation from the norm method. The deviation from the norm method is the one where the mean IQ is 100 and the standard deviation is 15. So here, those are pieces of information that you have to memorize. And when you go over the stats section with Dr. Kudroth, if he's the one doing this, you'll go over this in detail. So they could ask you, what's the IQ of 68% of the class? They could ask you, what's the IQ at the 84th percentile? So you need to know that the mean IQ is 100, and then the standard deviation is 15. That's the deviation from the norm method. The other is the mental age method, where basically it's a formula. IQ equals mental age divided by chronological age times 100. So mental age is how you perform on the test. Chronological age is your age in years. So if you score like a 12-year-old, but you're only 10, what's your IQ? It's 12 divided by 10 times 100 equals 120. Okay? So these are two types of things that you will go over, and they can appear on the exam. When we measure IQ, we have IQ tests for kids, and we have IQ tests for adults. The adult IQ test is the WAIS-R, which is the Wechsler Adult Intelligence Scale Revised, and it's for people 17 and up. For children, we have the WISC-R, which is the Wechsler Intelligence Scale for Children Revised, and we also had the Stanford Binet. So these are two types of tests that you need to realize. Then we have tests, and there are two types of personality tests. These tests are either objective or they are projective. So if you have the objective test, it uses simple stimuli, for example, a question. You don't need a lot of clinical experience, and that could be an example of the MMPI. The MMPI is a test that has over 500 true and false questions. So it asks you questions, you pick true or false. I'm able to score it. I could put it in a computer, and it gives me a result. The projective test is a test that uses ambiguous stimuli. What does that mean? There's really no right and wrong answer. So you look at it, and it's your own interpretation of these things. Examples of the projective test could be the Rorschach, which is the ink blot, right? It could be the sentence completion, where they give you part of a sentence and you have to complete it. It could also be the thematic apperception test, where they give you a picture and you have to tell a story. That's the TAT. Or the drawings. Which one do you think would be easier for kids? Doing a test that has 500 plus true and false questions, or me giving you a pencil and a paper and say, draw a house and a tree? Definitely the projective would be better with kids than not. Okay, so what is projective? In the projective test, what's happening is that whatever I'm seeing will be what I interpret. And again, I'm going to try to draw something. Understand that got to be in black. So for example, if this is the ink blot, let's color it like that. And I were to say to you, what do you see? Some of you might say, this isn't a very pretty ink blot, but bear with me. Yeah, it does look like a peanut, right? Some people might say like goggles. Someone might say it's a butterfly. Someone might say it's a bow tie. So someone might say it's a sunglasses, a dumbbell. So all of us are saying something different. But for me, it's a mask of death. Where on earth is death in there? So that's my own interpretation, okay? So that's what the Rorschach is all about. When you do the TAT, the thematic apperception test, oh, this is too thick. Give me a second here. So the TAT, let's go to another one. The TAT, thematic apperception test, when you give it to adults, usually it's pictures of people, and they have to tell a story. When you give it to kids, it's usually pictures of animals, and whatever story they say about the animal will usually be a story about themselves, okay? So adults get pictures with people, kids usually get pictures with animals. Let's go back to the slides. I think we're almost at the end, if not the end. And the neuropsych tests are the ones that just detect organicity. And these are the two name tests. For example, the Halsted-Rattan is one of them. You've got the Bender-Gestalt. You've got the Halsted-Rattan, Bender-Gestalt. So these are common neuropsych tests, okay? Now, this section here is probably low yield. This section, oh, how messy. This section here, this one right here, all this part is going to be high yield for you. So understand that you will be asked questions on standard deviation. Do you need to know the names of the tests? No. Just understand that it's the two name tests. Another test that's common is the Luria, Nebraska. I wouldn't worry about it. These are tests where, for example, people who have HIV dementia early on have apathy, dysphoria, social withdrawal, concentration deficits, cognitive deficits. So a lot of times it gets misdiagnosed as what? Depression. So if I'm not sure, I could do one of these neuropsych tests. And what these tests do is that they're going to test different parts of the brain. And they will be able to say whether this is purely HIV or it's a depression. Those are the types of tests that you do. Now, let's talk about your exam. For step 3, for example, do you ever order neuropsych testing on anybody? No, of course not. Do I order it on my patients? Yes, because I have, and I work with neuropsychologists. When I was in private practice, I never ordered them because it's impossible to find somebody. So it's not something you're going to order routinely on a step 2 or on a step 3. At least I want you to understand what these tests help you with. Can neurotests help us between dementia and pseudo-dementia? Yes, they can. They certainly can. Okay, and I think we're done here. So let's go on our break here. And when we come back, we'll start with child psych. So I'll see you in 10 minutes.